All that said, I would like to introduce and bring up Dr. Palak Raval Nelson from the Health Department.
Thank you, Jim, and good morning. Welcome to Health Center 9. Listening to the news and reading information online, one would think that COVID-19 is over. And with 77% of Philadelphians 12 and older fully vaccinated, it is easy to understand why. The number of new cases being reported each day is going down, and it's becoming easier and easier to spend time with friends and family and in safe settings. It feels like things are getting better. But it's important to remember, better does not mean over. Up until recently, children under age 5 could not get vaccinated against COVID. As a mother, I know how scary and concerning it was to have to wait to get my children vaccinated. Today, we are pleased to announce that the next tool in our fight against this pandemic is available right here at our city health centers. Free vaccines for all Philadelphian children between 6 months and 5 years old. This is a momentous and joyous occasion, which is why we have such a talented and exciting lineup of speakers to talk with you today. First, I would like to introduce Mrs. Chanel Colney-Beacon, who is our Health Center 9 Director. Chanel?
Thank you, Dr. Raval Nelson. Good morning and welcome to Health Center 9. We're excited to have you join us today as we continue to honor our commitment to the community by providing COVID-19 vaccines to the communities by which we serve. It brings me great honor to stand before you today as we begin to provide the COVID-19 vaccine to children under 5 years of age. It's important to remember that the community that we work in every day have been bruised and battered by the COVID-19 pandemic. People are hurting, tired, and anxious. So this is why we are here today, to remind them that we can help and take even just this one thing off of their plate. Before I turn things over to Dr. Victor Ibikiti, Pediatric Clinical Director, please note that all of our health centers are equipped and ready to provide the COVID-19 vaccine, including all of our annexes, which can do so on a walk-in basis. Health centers 3, 6, 5, and 10 will provide such a vaccine on a walk-in basis. For our established patients, you can feel free to make an appointment. To do so, please dial 215-685-2933. For more information on the COVID vaccine, to find out where they are in the Philadelphia area, please visit phila.gov/vaccine. Thank you. Dr. Ibikiti?
Good morning. Let me start by giving you a little perspective on vaccinations and why we believe in them. 25 years ago in Philadelphia, that's just about one generation, Temple Children's Hospital, Holy Redeemer Hospital in the suburb, and a lot of suburban hospitals all had pediatric units, 10, 15, 20 bed pediatric units. Today, none of those pediatric units exist. Not at Temple, not at Holy Redeemer, and not at most regional hospitals. So what happened 25 years ago? There were 2 vaccines. Prevnar, that treats serious bacterial pneumococcal infections, and the rotavirus, that treats vomiting and diarrhea in children. Up until then, vomiting and diarrhea illness and pneumonias constituted 60 to 70% of why children were admitted in the hospital. Once those vaccines came, the admissions stopped. The hospitals couldn't keep open the units, and they all shut down. That in itself tells you that the vaccines work. That tells you that the vaccines work. So fast forward to today, we're talking about the COVID-19 pandemic. Unfortunately, this isn't going to be the last pandemic we'll face in our lifetime. But this is one pandemic that gives us the opportunity to do the right thing by our children, get them vaccinated, give them a future. It's always going to be naysayers and some information out there that isn't just true. But I urge all parents, speak to reliable sources, knowledgeable sources, get the right information, and vaccinate your children. Thank you.
Good morning, everyone. Thank you to Health Center number 9 for welcoming us. Providing vaccines for our youngest that have been largely unprotected during the pandemic is essential. It is a huge win for public health and preventative care against COVID-19. We have come such a long way in our fight against COVID. Over 220 million Americans have been vaccinated, 100 million are boosted, and daily deaths due to COVID-19 are down by 90%. I applaud the work of the Biden-Harris administration's vaccination campaign, the nonprofits, federally funded FQHCs, city health departments, community organizations, and hospitals that have worked tirelessly to make vaccines, treatment, and other tools widely available for the people. Vaccines now available for children under 5 is a historic milestone in our fight against COVID-19. It means after being authorized by the FDA and recommended by the CDC after rigorous scientific review. The United States is the first country to protect our youngest children with COVID-19 vaccines, offering safe and effective mRNA doses to children as young as 6 months old. For the first time, virtually every American can access the protections from these life-saving vaccines from our youngest to the most seniors. It means that tens of millions will be able to receive, and many over 5 already have. As regional director of this great region, and I have to pause and say, this is very nostalgic for me because I remember walking down Shelton Avenue and coming to Health Center number 9 with my mother and my brother, and my first exposure to a physician of color that inspired me was right here. So I'm really looking forward to going inside. Okay, now back to the remarks. As regional director to include Pennsylvania, Delaware, West Virginia, Maryland, and DC, it is my responsibility to ensure that people are aware that these COVID vaccines are available for infants as young as 6 months and all children, both Pfizer and Moderna. That I need to make sure they have the resources, that they have access to vaccination, and that it is all barrier-free. Through my office, we have reached out to nonprofits, city health departments, hospitals, FQHCs, private practice pediatricians, and every place that children receive the vaccines to educate, to make sure they know the benefits far outweigh any small risk associated, because we know that the majority of children are healthy, but that is not enough to protect them. Half of the children that we lost to COVID were kids without any pre-existing medical conditions. As regional director, of course, COVID, and you all know me, has been a huge priority. The recovery, the response, but also maternal health, health equity, mental health and wellness, the opioid crisis, and all the public health concerns that impact our region. And again, it's my responsibility to inform the communities, the city and state organizations of resources that are available so that everyone can achieve their best health outcome, and promote the work that's being done, advocate for more that needs to be so we can have joy, longevity, and our health. Thank you so much for your time.
Questions from the press?
Yes. What, Dr. Shamford?
I'm sure you got most of the questions.
Yes.
What did you learn from the first rollout initially of the vaccine that you're going to use now for the rollout of children to make sure that people get vaccinated?
Okay. So the question was, what did I learn about the first rollout, presumably for children, or all vaccines?
I know that you were very involved in that.
Okay, so I would say that there's basically three groups of people. The first are the people who have already gotten their babies vaccinated, that have been waiting for this day for a very long time. The second group of people are kind of the wait and see. They need to see what's going to happen when their friends get their children vaccinated. Were they sick? Were they irritable? How long did it last? How did they feel? They need to see it. And then we've still got our third group of people who are like, no way, no how. And with them, we have to take the time to listen to their concerns, what may be preventing them, and educate them and assure them of the safety and why just because your baby may have had COVID is not a reason not to get the vaccine. And that is not enough.
What are some of people's biggest concerns?
So I think one is that I just mentioned that they had COVID. So why do I need to get it? Having had COVID gives you minimal protection. When you add the vaccine on top of that, it boosts, if you will, your protection and your immunity against it. The other thing is, even though our children may largely be healthy, when they are exposed to their teachers, their doctors, their grandparents, their parents, the community, someone else may not be so fortunate. And we also know that long COVID is real, with people having COVID fog and fatigue and shortness of breath. And right now, it's preventable. It's not necessary for anyone to experience that.
What are the biggest obstacles that you foresee that you're working against to get people vaccinated?
You know, the obstacles that existed in 2020 and 2021 aren't there anymore. They really are not, right? Because as you heard the doctor mention, it's available, it's free. Pediatricians are administering it. I should mention that pharmacies are only able to give to children 3 years and up, and that's good. That's good. The government got that right because children need a special touch. You need to take time with them, you need to observe them afterwards, and you need to make sure the experience is as pleasant as possible, because what happens to them now impacts the relationship they have with doctors in the future. And so not doing it at a pharmacy for that young age was the right decision.
Other questions, folks?
I'm cool.
Can you put in perspective and explain to people how this will impact families, especially those that are, think COVID is over that don't have kids?
How this will impact families that don't have kids.
No, explain to people.
Yes.
Especially because I think parents are very aware about, the risks, but some people that might not have kids maybe have been living their lives like COVID is over. Can you just explain to everybody how this will impact families?
Okay. So for people who have children, they've been largely unable to do a lot of things for fear that their child might get sick, not sending them to daycare because they're afraid that when they're exposed to a bunch of other unvaccinated children that they're bringing that home, which I do know has happened personally to a lot of families. And again, when an infant has COVID, and sometimes they're short of breath, and sometimes they have other sequelae, there's only but so much we can do that's supportive. It's much easier to prevent it than it is to treat it, because you don't know what path that child may take. And as I mentioned, even healthy children have succumbed to coronavirus disease.
And this might be a question for the health department, but when did the vaccines for under 5 start? Is today the first day that that's being administered?
No. So it actually, well, do you want to answer that? Okay.
Thank you. So the question was, when did vaccines start at the health department? We have been providing vaccines for under 5 for the past week.
For the past week?
Yes.
Is there any information on how many people have come in for the under 5 group, the newly eligible group?
Not as of yet.
What we're doing, Jack, we're waiting until we get a couple more numbers, trying to
Okay.
get the numbers boosted up before we put it on the dashboard. So they'll be up soon. Hopefully, as more people get vaccinated, that'll speed up that process.
Okay, thanks.
So do people have to wait and get an appointment to come here, or can they just walk in?
That's incorrect. So for established patients of the health centers, they can schedule by appointment by calling the 215-685-2933 telephone number. For those that are not our patients, they can be seen at the annexes, which is Health Center 3, 5, 6, and 10. They can do so on a walk-in basis, Monday through Friday from 8 a.m. to 1 p.m. And the proof of residency is not required.
Can you clarify when people can get these vaccinations, how long they've been available? Dr. Stanford mentioned that you can't get them at pharmacies for under 3. And can we just kind of clarify all that?
Sure. So Victor, if you'd like to come up. So with our City of Philadelphia health centers, we can provide vaccines from 6+ months all the way up to adulthood. And that is throughout all locations at our health centers, either by appointment and or walk-in basis.
And then some vaccines are available at pharmacies?
Victor, would you like to speak to that?
All right, so for all of the reasons that Dr. Stanford mentioned, it's been decided that pharmacies can vaccinate children who are 3 years and older. So for the 6-month-old, the 1-year-olds, they cannot be vaccinated at any pharmacy right now. And so for those patients that are in that age category, we do vaccinate them here at the health center.
How many locations across the city are available for young children?
So for the city health centers, we have 8 locations. And this is one of the 8. Health Center 9 is one of the 8 locations we have in the city. I can go through them. There's Health Center 2 in South Philadelphia. Health Centers 3 and 4 are in West Philadelphia. Health Centers 5 and Strawberry Mansion are in North Philadelphia. Health Center 6 is in the Northern Liberty section of the city. Health Center 9 here is in Germantown. And Health Center 10 is in the Northeast.
And I guess are pediatric vaccines available at pediatricians' offices, or are they?
Well, right, go ahead. Yes.
So, yes. So the places where you can receive, as the doctor said, the pediatric vaccines are certainly at the health centers, at the federally funded or FQHCs. They can be received at hospitals. They can be received at private pediatricians' offices. They can be received at some community-based organizations, I have to say, like the Dr. Ayla Stanford Center for Health Equity. And the vaccines largely became available the week of the 20th, Juneteenth week, and slowly as they're being ordered and being delivered is when you'll see it more. It's both Pfizer and Moderna, depending on what the practitioner requested and how many doses. But both are available, and everyone gets their allotment from the city of Philadelphia.
Is there preference?
Has there been? I think it's too soon to tell. There's benefits to both. I mean, I can just briefly mention that Pfizer is a 3-dose regimen. Moderna is a 2-dose regimen, and they're spread out. Some people who want to perhaps get immunity sooner, if you will, may choose Moderna, but the dose is higher, so they may have more side effects of being tired and a little achy and things like that. Some families are saying, well, I got Pfizer. We're a Pfizer household. I want everybody to get Pfizer, right? But in terms of the side effects or adverse profile, it's headache, it's fever, it's lymph node swelling near the site of injection, but not the anaphylaxis that we sometimes saw with adults, and not the myocarditis that we also saw with adults. Those things have not been reported in the 5,000 children reviewed by the FDA and the CDC.
And how many doses did the city of Philadelphia order for this first phase, I guess?
Jack, I'll get back to you on that.
Okay.
Yeah.
Because it's the providers order from us,
Right.
and then we'll pass it through to them. So I'll get you numbers for the health centers and for that.
Okay, thanks.
But I can tell you there was plentiful amounts for everyone that ordered. And unlike the adults, as I'm sure you guys remember in 2021, where we were like, don't open a vial, you don't want to waste it or lose it, that's not the case for the children. If a child is present, you open the vial and you provide the vaccine.